What about someone that's suffering from some arthritis and and they're say a senior citizen, and they say, well, everyone my age seems to have some kind of arthritis. What would you tell those people?
Well, there is treatment again or there are different types of treatment for people with arthritis. Yes, the degeneration of the joints is going to be there.
Yeah.
But exercise is good for these people. Something that really tends to help a lot of people with arthritis is aquatherapy, the therapy in a pool, in a heated pool. There are different entities in town that would offer that. And you can either become a member of these entities, or you can just go through a physical therapy program where they and then teach you certain exercises. You gotta remember, when you're in the water, you're not fighting gravity. So it's a lot easier to do these movement exercises and a lot less stress on your joints and on your body.
Well, people think the only options they have are surgical ones, but certainly not. I mean, you utilize in your practice muscle stimulators. You use the electrical nerve stimulation, which it's called the TENS, the interventional therapies, the radio frequency lesioning, and also medications as well. It's like an arthritis medication, Celebrex. I remember years ago, it was Celebrex, and people really liked it, and then they determined that it could be dangerous, and I don't remember what the danger of heart valve, something like that.
Increased cardiovascular disease.
Okay, and now it's back again. I'm hearing it advertised again.
Right, and at the time what happens is the company pulled it off the market, everything was clear. Two medications that specifically were removed with Vextra and Vioxx.
Yeah,
Celebrex back in the market.
I pick them all. They were good.
Celebrex back in the market as long as the other anti-inflammatory medications you get over the counter. But studies show that there might be, although with Celebrex seems to be less risk than with the regular anti-inflammatory medication, and it's because of the mechanism of action.
Do you use the medication kind of as a last resort? I mean, are you trying to do the muscle stim and the radio frequency stuff and all those?
Actually, it works the other way around. Medications play normally the first role, especially anti-inflammatory medications.
Yeah.
Muscle relaxants. In some cases, we use opiates or control medications to help the pain. Sometimes we have to prescribe anticonvulsivants or anti-seizure medications and antidepressants because pain is so complex. You have to look for different pathways in our body, in our nervous system, to block those pathways. So different solutions, I meant. So these medications in particular can help to block those different pathways.
I know as far as inflammation goes, I mean, not much good is going to happen until you get rid of that inflammation.
Correct.
And
sometimes when the problem is chronic, the inflammation might be gone. But then there are other pathways of like what we call neuropathic pain that comes from nerves. It's like overfiring of these nerves.
Yeah.
That there's no obvious inflammation anywhere, but the nerves are damaged or irritated.
Right.
And somehow you need to control that.
Yeah, and that's tricky stuff. I mean, you hear about people that have had a limb amputated. Had their leg amputated, and their toe hurts or itches or whatever.
They end up with phantom limb pain.
Yeah.
Correct.
Yes.
What about as we get close to being out of time here? If someone does experience back pain, I guess one of the most important questions to ask would be, how long should people wait? I mean, because I know for most people, the first day or two, they're going to think, okay, I've tweaked something, I've done something, I'll take an anti-inflammatory. And then maybe after a couple of days, they say, well, maybe I ought to put some ice or something. Maybe I ought to rest for a day. When should people start saying, okay, I need to go to a doctor?
Well, I'm going to tell you this. If you hurt your back and within the next couple of days it doesn't resolve, look for help. Look for your primary care physician first sure. Now, if this continues to last about after a week or two, seek a pain specialist because early treatment, the key to all this, to success in most cases, is early treatment. The earlier the better. You don't know what's happening. You're not a doctor. You don't have the tools to self-diagnose yourself. So there is help out there. Look for help.
Well, I mean, especially after the story about the lady that ended up with a kidney cancer.
Absolutely.
I mean, if it's something like that, I'd want to know as early as possible.
Absolutely.
You hurt yourself at home. Well, some people are not sure what to do. Do we put ice on it first, and then we put heat, or moist heat or dry heat?
It is recommended that within the first 24 hours, some people extended 48, you use ice. And then
Ice.
after that, you can start using heat to kind of relieve the spasms of the muscles that occur as a reaction to your sprain or to your injury. Over-the-counter anti-inflammatory medications are helpful as well. Some stretching exercises. So all those things that you could do at home if you don't have the resources to go to a physician quickly.
I see. Well, Southeast Anesthesiology Consultants they founded Southeast Pain Care back in '97, and Southeast Pain Care has grown rapidly, currently operating a network of 12 pain management clinics serving more than 40,000 patients throughout the region. And our location is located on Roosevelt Boulevard near the hospital. And y'all opened back in '06, and like we said, it's located just off of East Roosevelt Boulevard, directly behind the Monroe Urgent Care Center and the Bojangles, in that area there. But you've got exam rooms, physician and nursing offices.
Physician assistants.
Okay, how many doctors work out of that facility?
4.
4. Okay.
And we have 2 physician assistants that will go to the clinic. But each day there is a doctor and a PA, or just a PA. So not all 4 doctors in the same clinic at the same time.
Would you recommend someone has an injury, say they're weekend warrior, overdid it, whatever, and they got some pain, and they put some ice on it, whatever. A couple days have gone by, this back thing, I just don't think it's going away. Would you rather see them first, or would you rather get a referral from the regular doctor? What's the order, you think?
Well, again, in the beginning, because the majority of the back pain will resolve within the first few weeks, the first few days. It's not bad or uncommon to go see your primary care physician. That would probably be the first choice, or to go to urgent care if you don't have a primary care physician. But once again, if this pain persists, seek for a referral or a consultation with a pain specialist.
Okay. I know some people go straight to the emergency room, and I just, sometimes my experience there has been they're looking for a broken bone. If you had an injury, they're looking for a break. And then when they don't see one, well, that still hurt. But there's such things as microfractures, and
Absolutely.
and you could have done some
micro injury of the muscles or ligaments.
Yeah,
or
which the typical X-ray won't show.
And then you have the patients that will go to an orthopedic surgeon or a spine surgeon immediately, thinking that surgery is going to be the solution to the problem. And in many cases it is, but in many cases it's not.
I went to one of those places with my neck, took an X-ray, nothing broken. They said, our office will call you to schedule an MRI to get a better look. When I left, I had all this paperwork about the MRI, but they also had the paperwork in there about scheduling my surgery. And I left thinking, you know what? They don't even know what they haven't even done the MRI yet. They don't even know for sure what's going on, and they're already wanting to schedule surgery. That's because surgery should always be the last resort.
I personally think that's the case, and myself being a chronic pain sufferer, that's what I would do in my case. I would search for all the other options that can help me before I succumb to surgery.
Once they
there are cases, let me clarify that, we'll need surgery. There are certain nerves that are pinched, and if you don't release them, you're going to end up with permanent nerve damage. But just try to do other things that might help, and don't think that surgery is going to be the ultimate cure to your problem.
Once they start fusing those vertebrae together, they tend to just keep going on up with the fusions.
That's correct. The problem is you fuse to a level, and years later, the levels above and levels below are going to continue deteriorating, which will require another fusion in a few years, etc., etc.
Yeah.
It's a snowball sometimes.
Yeah.
Thank you for coming in today and talking to us. If folks feel like they need your help or want to, how can they get in contact with the office?
Well, they can get either a referral to our Southeast Pain Clinic in Monroe. In certain cases, we accept self-referrals. There is a screening process, some questions that they need to answer. And so we'll determine if they are candidates for self-referrals or candidates for referring for a physician if they need a referring order.
Mm-hmm.
Okay.
Okay.
Very
And the phone number there, if you'd like more information, is 704-291-9360. And again, they're located 701 East Roosevelt Boulevard. There in, with the urgent care and the Bojangles there.
Across from the
Across
hospital.
from the hospital,
Yeah.
yeah. We certainly appreciate your time.
Thank you.